Hello, ladies and gentlemen. Thank you very much for joining me here today for this hopefully very valuable webinar on treating specific autoimmune conditions according to Ayurveda. Today, we're going to talk about treating autoimmune conditions specifically for the muscular skeletal system, specifically rheumatoid arthritis and fibromyalgia. The only difference between the two from the Ayurvedic perspective is that the rheumatoid arthritis is inflammatory condition brought on by an immune response and in the joints, and fibromyalgia is more related to the connective tissue and the muscles. But as you will see the treatment and approach is very similar. We're not going to talk too much about understanding autoimmune condition, but I will cover it to some degree. It's very important to understand how to differentiate between an autoimmune inflammatory condition and a non-autoimmune inflammatory condition. The main factor is with say we compare rheumatoid arthritis to osteoarthritis or degenerative bone condition where there's also pain. When there's a degenerative arthritis, osteoarthritis, there can be no toxins in the system. The system still could be clean from Ayurvedic point of view. There can be no Amla, and you can still have arthritis because it's a degenerative condition. It's the degeneration of the cartilage, the tissue, the joints, and then they're inflamed due to the lack of cartilage, the touching of the bones, and it's due to the dry, rough, hard, mobile qualities of Vata. This is why in Ayurveda we call it A.H.P, Gata, Vata. A.H.P meaning the bone system, and Gata, Vati means Vata, in the bones. So this is the Ayurvedic term for arthritis. But when we have rheumatoid arthritis, we have the extra factor, the cause. The pathology is completely different. Well, degenerative arthritis is due to extended degeneration of the bones due to Vata, and sometimes Vata pushing Pitta. But when we talk about rheumatoid arthritis, there's no degeneration of the bone. There's inflammation of the bone, and this is due to the immune system overreacting and over-responding. So there has to be more than one treatment. There's a simultaneous treatment of treating the immune system to modulate the immune system, which is governed by Pitta. So when there's rheumatoid arthritis, there's a Pitta element to it, not just like degenerative arthritis. It could be a purely Vata dominant condition. But when you have rheumatoid arthritis, there's Pitta. It's now a Pitta condition because the immune system, or we could say like the T cells that are attacking the pathogens, this is Pitta. At a cellular level, this is called the Tejas. In Ayurveda, there's Vata, Pitta, Kapha, the communicative aspect that's communicating amongst all the cells at a cellular level. And then the Kapha, which is the membrane protecting the cell or protecting the tissue. And then there's the Tejas, which is the immunity inside the cell. So autoimmune condition, according to Ayurveda, is at a cellular level. It's the Tejas, or the refinement of Pitta, attacking the Ojas in the body. So it's from Western perspective, we're going to see inflammatory markers like IgG, IgM, IgA. These are all rheumatoid markers that would show that the immune system is overactive, and they would then classify it as rheumatoid condition. And rheumatoid condition can be more than just in the joints. It's an inflammatory condition, and we're specifically talking about rheumatoid arthritis, which generally has a more destructive quality because Pitta means fire, so it's got an inflammatory aspect of it. So this is why we see more destruction of the muscles, sore muscles, more inflammation, and often the inflammation is on equal side, like both hands, both knees, and there's often some deformation to the through the joints into the knuckles. And the inflammation can be, day or night, even when you're sleeping, because the immune system can still be, overactive and attacking the tissue, in this case, the bones, the muscle tissue, and creating the inflammation and literally destroying the tissue, whether it's the bone tissue, the muscle tissue. So it's more serious and it's more tricky to treat, because you're not just rebuilding cartilage and bringing down inflammation, but you're having to modulate the immune system. So it's important to understand the pathology for an arthritis condition, or and in Ayurveda, this is coming from starting with vata in the colon. The home of vata is in the colon, apanavayu, and the qualities of vata are dry, light, rough, cold, mobile. And when these qualities increase too much, we call sanchaya, where it starts to increase or accumulate in the colon. So you could have dry, hard stools in the colon. Then you have prakopa, where it's overflowing. It's coming out of the colon, coming up into the other parts of the GI system. And then prasara, where it starts spreading into the blood. So what's spreading? The ama is spreading, the toxins are spreading, and the quality of vata, cold, light, dry, rough, mobile. These qualities are now spreading along with ama. What's ama? Ama is the toxins, metabolic toxins accumulated from your own poor digestion. And this is, can come from slow, sluggish digestion, manda agni, a variable digestion where you're having a lot of gas and bloating and constipation, vishama agni, or trikshna agni, where you have sharp, strong appetite with acid reflux, heartburn, and excessive appetite. So either of these three types of digestive imbalances will lead to creating ama in the GI tract. But mostly in arthritic conditions, when we're talking about the bones in particular, it's coming from vata, because the qualities of our bones are also similar to the qualities of vata: dry, light. There's air in the bones, and so vata has a affinity, we should say, to the bones and the nerves. So indirectly, we're saying that the toxins are coming from your digestive system and from the constipation in your own colon. And then it's spreading throughout the body, through the circulatory system. Vanavayu is spreading it. So Vanavayu, the circulatory system of the body, is pushing it through the system, and then putting it in whatever weak tissue you have in your body. Kavai gunya. This is your weak tissue. Now, this could be genetic. Maybe you have the genetic disposition for having weak bones. You have the genetic disposition of having weaker nerves. So then it's these toxins which accumulated over decades in your digestive system through poor digestion, then circulate through the body and then get wedged in the joints in this particular case. So this is the pathology. So we call it ama, or toxins, in the joints. Ashti, gata, vata. Ashti meaning your bone tissue, and gata, vata means this vata quality has entered the bones. And it's with ama. When there's rheumatoid arthritis, there's always a high amount of toxins. It's very important to understand, because when a person has a high level of toxins, you cannot put oil massage on them. You cannot give them external oil massage or begin panchakarma or steaming. You have to reduce these toxins down. Of course, how to identify the toxins, there's many ways, but fatigue, sluggishness, heavy film on your tongue, and these digestive problems are the cause of this accumulation of toxins that's now spread through your body, lodged in your joints, and now then it goes deeper into the cellular level. So these toxins go in at a cellular level, and then every cell now has toxins on it. And then the cells are unable to communicate with each other, not able to identify each other. And then the immune system, or tejas in this case, attacks its own tissue, the ojas of the other tissue. So it's toxins that are functioning as a pathogen that the immune system is attacking at a cellular level, destroying the other cells. And it's all due to the toxins. Because when you have too much toxins in the body, you become unclear. You have a foggy brain. You're not able to make good decisions because you have toxins pumping through your blood, into your bloodstream, into your mind. So cells are the same. When they have too much toxins covering them, they're making mistakes. They're confused. They're attacking each other. They can't identify the pathogen. So it's autoimmune conditions are at a cellular level. So in Ayurveda, it means that there's been a long history. We're talking decades of the accumulation of toxins in the body due to poor digestion and the accumulation of Amla. So to treat any condition, you have to understand the pathology, how it began, because you have to address these causes. So a lot of times we find people with, degenerative bone conditions in particular have been constipated for a long time. And now, of course, modern science knows that we absorb most of our minerals through our colon, particularly our transcending colon. And this is where people have the most constipation, and then they're not able to absorb these minerals properly. They're actually creating a type of autotoxicity, as a naturopath would say, and you reabsorb these toxins back into your own bloodstream. So even naturopaths seem to have a clear idea of this, just somewhat different wording. So what are the symptoms here? Of course, joint pain, stiffness, swelling. Usually it's the smaller joints that are affected more, because this is where, in the extremities, because the toxins are coming through your bloodstream, and then they're going to the extremities, your toes, just like gout is coming in your toes, big toe. And it's another type of toxin. Uric acid is a type of toxin. High cholesterol, high lipid levels is a type of toxin. So these are, in Ayurveda, we put all these toxins together and call them Amla. So you can have different types of toxins. And, you have loss of muscle, you have deformation of joints. You can even have some neuropathy. And once you have neuropathy, numbness, and a lot of times with people with rheumatoid arthritis, they also have insomnia. And that's because the nervous system is also involved. So we're really not talking about these toxins just being lodged in your joints and then creating this autoimmune condition, this inflammatory, destructive condition that starts destroying your joints, but they're also affecting your nerves at the same time and your muscles. Most people are not just going to have only their hands deformed by rheumatoid arthritis. You squeeze their muscles are sore, they're inflamed. They may have some sciatica, they may have some neuropathy, they'll have insomnias almost with every case. So the nervous system is also adversely affected. So sometimes we have to also treat the neuropathy, we have to treat the nervous system simultaneously. So you're really talking about 3 lines of treatment here. Often there's something that needs to be for the nerves and for the pain, to clean the toxins out of the joints and to modulate the immune system. And you'll have to now get to the causes, which are the poor digestion in the first place. So you can't just provide, here's your jar of herbs for your rheumatoid arthritis. And it doesn't work like that. Even we have such herbs and you took them and you gave them to your friend without an appointment, it wouldn't work, because nobody's removing the cause. It's like people who have many conditions, even cancer. If you only treat it and you never remove the cause, it's going to be a reoccurring condition. So you have to treat the cause, and we know the cause is the poor digestion and the accumulation of toxins. So we have to improve the digestion, and then we have to remove these toxins. So now we'll go through some of the herbs. We could do a few home remedies first. Home remedies are, one, very good for rheumatoid arthritis, is castor oil in ginger tea. Now, castor oil is a nice laxative. Of course, if you go to buy it, it says not for internal use, but you can ignore that. And mix it up with, get organic castor oil, and mix it with some ginger tea, like 2-3 teaspoons. Shoot that down at night. It's a strong laxative. Get the bowels moving, but it's also very good for joint pain. And of course, for your diet, you want to avoid all nightshades, which many people seem to have figured out when you have inflammatory conditions, particularly autoimmune ones, where Pitta is involved, then you want to avoid the nightshades: eggplant, bell pepper, paprika, of course, tomatoes, and particularly canned tomatoes. So we've got all these acidic foods. I mean, if you leave tomato in a can, it just, it dissolves the can after a while. These are acidic foods, and so they make the inflammation worse. Now, stopping these nightshades doesn't mean your arthritis is going to go away. It may feel a little better, but by having them, you definitely can increase it. And of course, there's other dietary guidelines. Too much big beans. That's right, big beans. Pinto bean, lima bean, navy bean are particularly increasing vata, because this is vata behind this condition. And rheumatoid, there's vata and pitta you're dealing with. So raw vegetables, raw salads, raw fruit, not fruit, but raw vegetables, particularly cabbage family, is increasing vata. Anything that's going to increase vata, like over exercising, over jumping, over exerting yourself, over sex, all of these things are going to increase vata. Anything increased vata is going to make the condition worse. So person needs to rest more, and they can have small beans like mung bean and lentils. These are usually preferred. And you should avoid heavy and hard to digest foods, because we know digestion was the initial cause. So snacking too much, having heavy foods, meat, chicken, cheese, beer, these things all will contribute to this condition because of their heavy and dense quality and hard to digest, which creates more ama, which then aggravates the condition. So you have to have a light diet, like mung beans, lentils, a little bit low protein, but not the large, and cooked soft food. So, with the diet, generally we make it based on the person's prakriti, vikriti, individual state. So if a person is thin, dry, cold, and light, we may give them a completely raw, completely cooked diet, and having some dark chicken and some fish. But if they're kapha prakriti and they're overweight and heavy, then we wouldn't even give any chicken, any fish, and we'd keep them only on the lentils. And if they were pitta, of course, we'd be more stringent about hot, spicy foods. Peppers, ginger, and even garlic would need to be reduced. So the diet still needs to be individualized. There's no one diet, but there are some basic rules: no nightshades, not too many big beans, and there's other home remedies that can be done. Well, kind of home. Enema. We use a dashamula guduchi enema, if that helps you any. But it's very effective. This is a herbal enemas. We don't do just water enemas, no, like colon hydrotherapy. It's just water. In Ayurveda is always using some herbs. For constipation, we're using triphala and salt and honey. For depletion of tissue like MS, we use ashwagandha, bala, honey, ghee. But in an inflammatory autoimmune condition, we want to use guduchi, because guduchi is anti-inflammatory, modulating the immune system, bringing down pitta, and dashamula, which is 10 herbs. Dashamula, it's very grounding, anti-inflammatory, and balancing vata. So it gives us dashamula guduchi enema, and this very quickly can help this condition. But mostly it's an herbal cure. The diet has to be correct. If the diet's correct, the herbs won't work. So the diet has to be balancing both vata and pitta and the vikriti of the individual. So that needs to be done on an individual basis. So we talk about the herbs. The most important herbs given in all types of arthritic conditions in Ayurveda is the gugulus. There's many. There's, Simhananda gugulu, Yogaraj gugulu, Kaishar gugulu, Rasyana gugulu. So here's pure gugulu here. Gugulu, it's black. It's a resin like frankincense, but it's darker. It's like frankincense is like the child, of gugulu. Gugulu's the king of resins, and frankincense, she's the queen. And it comes in different forms. Yogaraj gugulu here we have here, and it's about 20 herbs. And Yogaraj gugulu is mostly for vata and larger joints, and it's very warming. Kanchnar gugulu, another gugulu, it's usually used for tumors, growth, cysts, and reducing things down. Gugulus are very powerful. Kaishar gugulu, we make our own. And it's cooling. It's using a lot of guduchi, musta, anti-inflammatory herbs. And most of them all have triphala in them as well for the detoxing quality. And here we have rasna. And rasna is used for rheumatoid arthritis, and it's very much pain reducing. It's an analgesic herb. So they have a formula called rasna A.D. A.D means additional. Gugulu. So rasna A.D gugulu. Rasna plus some other herbs. In this case, we put triphala, musta, and maybe some guduchi plus the gugulu, and then you make the formula. You have to. We're looking at books and looking at the original ancient formulas, like a recipe book, and then we're making these formulas. And Nirgundi is also used a lot. It's analgesic if there's a lot of pain. It can be a little heating, but it's analgesic. So depending on the amount of pain the person has, there's many inflammatory herbs like frankincense, or we have shalaki is what it's called in Ayurveda. You can see there it says Boswellia or frankincense, but Ayurveda we call it shalaki. It's an extract. This is also very inflammatory. So these are some of the key herbs for it, and we have them in certain products, but they would be accompanied with other herbs as well. We're just talking about the main ones. So we talk about if you have, it depends on the individual. If you have a person who's vata prakriti, means thin, cold, light, dry, and cold, then we would use this one. See, we call it pain and detox. See, we use these simple terms. See, pain. See, it's for joint pain, nerve pain, and see, it says rheumatism right there. And you can see the ingredients: Yogaraj Gugulu, which is a formula which we make, Nirgundi, which is just for the pain, and Tagar, which is a sedative and also for pain and helping with the nervous system. It's also analgesic. But this is very warm subject formula, so you wouldn't want to give it to the wrong person. But this is for Vata. That's what it's called: Vata, pain, and detox. So it's doing two things. It's really doing one thing. It's detoxing the joints. Gugulus are called deep detoxers. They're not cleaning out the colon. They're not cleaning out your liver. They're not cleaning out your spleen. They're not focused on your blood. No, these are focused on what we call deep tissue, joints, muscles, and to some degree the nerves. So this is what Gugulu is doing. It's cleaning the deep tissue. So that's why they're fundamental for these muscular skeletal conditions. So we call it pain and detox because it's reducing pain by detoxing out the joints. And it's very effective. People do 4, 5, 6 jars, the pain's gone, because it's not just an analgesic pain reducing medication. It's literally going into the joints and cleaning out these toxins. But simultaneously, of course, we've given people Dipana Panchanama, which is herbs for before and after digestion to keep it strong and to get rid of the ama. That has to be done simultaneously. Now, if a person is more Pitta Prakriti, or they have a Pitta Vikriti, where we have heat, burning, acidity, hot, sweats at night, then we would give them a different formula, even though they'd have the same condition, rheumatoid arthritis, pain and detox formula for Pitta. And there we can see the first ingredient, which is Kaishar Gugulu, which is actually made up of multiple herbs, including Bibitaki, Amlaki, Haritaki, Musta, and a lot of Guduchi with the Gugulu. And there's even, we put in Nirgundi again, see, for pain. We're just adding that in to help with the pain. So it's for chronic muscle and joint pain. It's working a little bit better on the muscles and the smaller joints like fingers and toes. And a lot of these same formulas are used in fibromyalgia. So I'm talking about rheumatoid arthritis, but at the end I'm going to explain that the treatment is very similar for fibromyalgia. And then the third one we have, this is for the Kapha Prakriti, pain and detox, same name, but this is for stiffness, swelling, joint pain, and it's using a different Gugulu. It's called Simhananda Gugulu, and this one's got more Punarnarava in it, Musta, Triphala, Vibataki. So it's for overweight, heavy person with swelling, and it's very, very strong. And we can make variations of that too. Like I said, if there's a lot of pain, we do Rasna Adi Guglu as well. Now, if the person's very dry, they're very frail, underweight, dry, depleted, vata, then we can provide also some of these products, a similar product in a jam form. So we call it anti-inflammatory jam, but the real name is Dashamula Haritaki Leham. Leham means jam, and the two first ingredients are Dashamula and Haritaki. There's jaggery, cardamom, cinnamon, turkatu, which is 2 black peppers and ginger, and honey. So this is good for inflammation, mild constipation, swelling, arthritis, immunity, and it's building immunity and building strength. So this is for a weak, frail, underweight person who's very dry, and we want to give them the herbs in kind of a liquid form. And we could give them both. Now, if there's a lot of inflammation in the body, we may combine it. Particularly in the case of fibromyalgia, we would always provide the anti-inflammatory. An anti-inflammatory, is a Boswellia extract. I get to focus there. Which has got also curcumin in here. Curcumin, everybody's heard of curcumin now. There it is. Boswellia extract with some amlaki, triphala, no triphala, pipali, little pipali, and curcumin extract. So there's 2 extracts in here. Traditionally, Ayurveda doesn't use extracts, but we find these very effective for bringing down inflammation very quickly by providing this frankincense extract with curcumin extract mixed with some amlaki, turmeric, and pipali. Very, very effective. So, for example, fibromyalgia is usually it's an inflammatory condition of vata pushing pitta into the mamsa, the muscle tissue. We usually provide both, the anti-inflammatory plus the pitta pain. This is what we're providing. So, a lot of the herbs that I'm mentioning here are used in either condition with some variations. And now if there's such pain that the person's on pain meds, then we may want to provide some relief for that, which isn't exactly detoxing the tissue, because all these gugulus, they take a time. They take about a week, 2 weeks. Maybe a person does a jar, they come back and they say, oh, it's 20-30% better. So they do 2 jars, now it's 50% better. They do 3, 4, 5 jars, it's gone. And that's it. It doesn't come back. Unless, of course, you start the pathology again, go back to your bad habits, back to your poor digestion, accumulate more toxins, and it could come back. And usually people don't do enough of the treatment. Once they have no pain, they generally stop, even if they paid for the herbs. Then they call back in a few years later, and they got the pain back, and I found out they still got half a jar left. So a lot of time, it's much better to keep going after the symptoms are done in almost any condition, to continue with the herbs after the condition has come. But definitely rheumatoid arthritis and most inflammatory conditions, you should continue with the herbs even after you have no symptoms. Unfortunately, most people just stop because they're very happy, there's no more pain. But then you've only taken you've only reduced the toxins down in your joints, your muscles, or your nerves down to the point that it's not inflamed anymore. But it doesn't mean that you've removed these toxins down completely. That's why you have to keep going. So if you become my client, just remember that. But if you have a lot of pain in the beginning, particularly having to take opiates or aspirin, and we don't want you having to do that, so we can give you just some analgesic herbs that can help with pain, like Western tea right here, joint and muscle pain. You can see it's quite simple there. White willow bark, which is what Bayer used to make the original aspirin. Devil's claw, very good anti-inflammatory. St. John's wort, turmeric chopped and sifted. Skullcap is kind of a nervine sedative, and a little ginger. So this tea, if you drink it all during the day, you can avoid taking aspirin. It's like an herbal aspirin. Not quite as strong. People say it lasts about 2-3 hours, and if they drink it all day long, then they can avoid taking painkillers. We also have one powder, because powders are twice, maybe 5 times stronger than any tea anyway. So if they had a lot of pain, then here we have it also. Shilaki Rasna Adi. Remember we talked about Rasna earlier? It's a big pain reliever. So this one's just full of, it's got the curcumin, the frankincense extract, plus some gugulu, plus Rasna, which is analgesic, plus Nirgundi, which is analgesic. So we just call it for acute pain. And sometimes, you know, we maybe have them just take a dose of this at night so they could sleep. And the second one is probably more beneficial to the cause because it's got the googaloo in it. Now, if there's a lot of heat and burning sensation, and particularly acid reflux, then we would use another anti-inflammatory we call Pitta Balance here, and it's for heat, acidity, burning sensation, and choosing other anti-inflammatory formulas like Hamaduta, Mukti Pishti, you know, and Guduchi Sattva, and these are other Ayurvedic, very cooling herbs. So this is when the person's really hot, really burning up, and the muscles are very inflamed, are not, we may combine it, you know. It's picking the combination that's very important here. We may give them the Pitta Balance. If there's acidity, we'll take care of acidity, heat, and burning sensation, and then we'll combine it with the anti-inflammatory. And then maybe give them something at night. We also have many things in capsules as well. These are, we call them deep detox capsules, but that's basically Yogaraj Googaloo in a capsule. And sometimes if it's just Yogaraj Googaloo in a capsule, we put it in the formulas. See, stiffness, joint pain, nerve pain, sciatica, and other muscular pain. So we can combine it. Again, you have to know how to know these herbs very well, and then you can combine them to get the overall effect. And if the person's hot, we have another one called Cooling Detox, which is basically Kaishar Googaloo capsules that we didn't make for burning sensations, general weakness, and for kidneys. They have many different functions when they're in the capsule form. We can use them for different things. And of course, there's many oils we can use. We have Mahanarana oil, which we call anti-inflammatory oil. So usually this will be provided, but you don't want to provide an oil when you have rheumatoid arthritis until you've reduced the toxins down. Aloe vera is, of course, very anti-inflammatory, and particularly if you're Pitta, we have you take all the herbs that we just mentioned with aloe vera. If you're having trouble sleeping at night and having pain, we can give you Tagar capsules, which we just call sleeping capsules, but basically it's Tagar. Tagar is very warm. It's a sedative, nervine, and good, and it's analgesic, taking care of pain too, and working very good to get you to sleep. So again, we may give them something else. Now, to manage the immune system becomes a little tricky. You have to, of course, avoid things that stimulate the immune system in an autoimmune condition. Mushrooms, stimulating the immune system. People have to watch out for that. And many herbs have to watch out for, you know, that increase the immune system. Tulsi, and echinacea, golden seal, Oregon grapefruit. A lot of these are increasing white blood cell count, stimulating the immune system, and exactly what you don't want to be doing when you have an autoimmune condition. You have to modulate, you have to calm down the immune system, just like you would calm down a baby. Baby's crying, rah, rah, rah. And you have to speak gently, you have to stay calm, you have to calm them down. And once they're calm, you're fine. And that's the same way with the immune system. Once you get it calmed down, it will stay calm. But if you go out and have a bunch of reishi mushrooms, shoot up some ginseng and some other immune boosting herbs, then you could trigger it right back on again. And it's often the cause for some people that have autoimmune conditions that are young, because they're doing a lot of these supplements and they don't know what they're doing. They put them all in a smoothie and they overstimulate their own immune system too much. I've seen it many times. We have an immune modulator here. It's called Amlaki Rasiana, and that is made from the dried juice of the amlaki berry. And if you can see, the first thing on it is immune modulator. It modulates and brings down the immune system. So it's good. See, it says right there, good for all autoimmune conditions. Hair loss. It's also good for stress. It's anti-aging. Just a really wonderful, wonderful formula. It's the amlaki. You know, amlaki is anti-inflammatory, high antioxidant, super high in vitamin C herb. And sometimes we will even give some amlaki tea, amlaki enemas, put more amlaki in other ways to bring down the immune system. But the amlaki rasiana is the preferred and most effective way to do it. So you just have to get the right mix, right diet, few home remedies, and the right mix of herbs. And as the person progresses, you know, and the toxins are coming down, the tongue becomes clear, the energy comes up, the pain is coming down, then these herbs need to be changing as you're going along to account for the condition. And once you have the toxins low enough, then you can start to give oil massage, steam, and you can do other types of treatments. Now, the name of our talk was about two autoimmune conditions, rheumatoid arthritis and fibromyalgia. So the difference with fibromyalgia is that we're treating the muscular system more than we're treating the and the connective tissue in particular. I think there's like 12 or 18 little points all over the body where the connective tissue is, where the doctor will press on. And if you have enough of them or are inflamed, then you're diagnosed with fibromyalgia. But basically, it's very simple in Ayurvedic terms. You have, Pitta, heat in the muscles. And it's due to the immune system overreacting and attacking itself. So usually there's more Pitta balancing herbs for this condition. The Kaishar Gugulu is used more than the Yogaraj Gugulu. It's the preferred one. Usually when it's fibromyalgia, we're using the anti-inflammatory plus the Kaishar Gugulu, not the Yogaraj Gugulu, because it's more Pitta dominant. Those two we're using for fibromyalgia and working very well. And then we can add in the because it's an autoimmune condition, we can add in the Amlaki Rasiana to help modulate the immune system. And then there's usually more herbs for building the muscle, like Ashwagandha, supporting. This is the premier herb for muscles. So there'll be Ashwagandha in there, which we wouldn't have if you were just working with the bones. And then Dashamula is also good for building the bones and bringing down inflammation in muscles. There's Amla. We have organic Amla there. And that's also good for the immune system and for the inflammation. So, the quantity is very important. I mean, you can know all these herbs, but if you don't know how to mix them together or make the formula in the right quantity, then, that's where the devil's in the details, basically. So, but it is a very treatable condition. I've had a lot of success over the years. And people have come in on walkers, on wheelchairs. And even within 1 month, they're off the walker, off the wheelchair. And of course, if you see my testimonials, you can see I have hundreds of testimonials for people who have been very happy with this Ayurvedic treatment. And keep in mind, if there's other things like anxiety, nervousness, and poor sleep, these need to be treated separately. So, and sometimes even with fibromyalgia, there can be signs of depression because of the chronic pain. And of course, when your muscles are inflamed, you have fatigue. So chronic fatigue syndrome is a symptom of this inflammatory muscle condition. Because when your muscles are inflamed, even talking can be tiring. And they usually have other sciatica and other type of nerve pain. So, the diagnosis is very important to have a clear diagnosis. But nowadays, we have these rheumatoid factors, which can be seen very clearly in their blood work. And if those are evident, then you have your diagnosis and you can proceed if you have the herbal knowledge to prepare and take these formulas in the proper way. And then sometimes I'll even mix them. I won't even, all these formulas I have on the shelf, I still would rather mix, say, Yogaraj Gugulu with Kaishar Gugulu and put in a little Rasna, I mean, I just have this idea in my mind, this person isn't right in the category. So I just make the formula right from scratch. And then after they come back in 1 month, if their pain is significantly better, I may take out the analgesic herbs like the Rasna and the Gundi and just give them pure Kaishar Gugulu. And these other analgesic herbs like the pain tea, I'll take these back because they're not necessary for long-term use. And maybe I have to treat secondary conditions in the second, third appointment, like insomnia, fatigue, and stay on the digestion and elimination the whole time, because it has to maintain good digestion, good elimination throughout the whole treatment. So if you're studying Ayurveda, I hope that helps you out. I mean, I've communicated to the best of my knowledge about the Ayurvedic approach. Feel free to add or correct me if you find any of my information was lacking. Ayurveda is a lifelong science. There's nobody that knows it completely, and I always welcome feedback, and we're all trying to learn. And for those of you who are studying Ayurveda, I hope this helped you to better understand these type of herbal treatment for these two autoimmune conditions. Otherwise, feel free to contact me. I'll be happy to speak to you on the phone and answer your questions and look at your blood work and give you my prognosis of your condition. Once again, thank you very much, ladies and gentlemen, and I hope I hear from some of you.